And I'm Dylan Black. Essilor Canada is the world's largest eyeglasses lens manufacturer, and they are working to drive awareness towards myopia. Let's find out more right now. We say hello to Dr. Cassandra Chung, expert optometrist with Essilor. Nice to have you here, doctor.
Thank you so much.
Bit of a history lesson on Essilor. Been around for quite some time.
Yeah, so Essilor's been around for about 170 years, providing visual solutions to everybody around the world. And really right now we're just talking about the advocacy that they're bringing towards myopia control.
Okay, so let's talk about myopia, because maybe not an everyday household word, right?
Yeah.
So what exactly is it?
So myopia, another word for it is nearsightedness or short-sightedness, when people have a hard time seeing far away. So kids that present with nearsightedness, they'll have trouble seeing the board, stuff like that, but they'll still be able to see clearly up close.
Okay, so you're trying to help kids to be more specific here, correct?
Yeah, absolutely.
What is the issue? How big of an issue is it with children?
Myopia is becoming a greater and greater issue. Essilor's been doing research on myopia for a really long time, and essentially what we're finding is that nearsightedness in children, although it can't be stopped, we can reduce the risk for progression.
Well, that's good.
Yeah.
That's good news. So you have to get it early then?
Yeah, definitely. So the key to implementing myopia management is early detection, because the earlier that we can detect it, the more effect that we can have on reducing those risks.
Can I ask how it's detected as an optometrist? How do you notice that a child has myopia?
Yeah, so we would notice it during a regular vision check.
Simple as that.
Yeah,
right?
Absolutely. So kids, we recommend having an eye exam at least every 6 months or 1 year, depending on what your optometrist or eye care provider advocates for them.
Mm-hmm.
But yeah, that's something that we would discover during a regular eye exam.
Okay. Let's talk about it is a growing epidemic. Now, is it because it's just all of a sudden growing, or has it been like this since the beginning of time and we're just noticing it now?
That's a great question.
Yeah.
Myopia has always existed for sure, but it is a growing epidemic. So in North America, by 2020, 35% of the population will be myopic, and 58% will be myopic by 2050.
That's too much.
Yeah, it's a lot.
That's a lot.
Yeah.
Is it 400,000 Canadian kids living with vision issues?
Yeah, so there's a statistic that says that 400,000 Canadian children live with uncorrected vision issues.
Okay. Eye diseases are all related, correct? So if myopia is an issue, it could cause other problems?
Yeah, so the reason why we want to implement myopia management or myopia control and reduce the progression of nearsightedness in children is because at higher amounts of nearsightedness, we increase our risk for certain eye diseases like glaucoma, cataracts, retinal detachment, and myopic macular degeneration. And unfortunately, once we develop these conditions, there can be permanent vision-threatening effects that we can't just fix with glasses like we can with nearsightedness or myopia.
Okay. Is there just a lack of awareness when it comes to this right now? Is that one of the reasons why? I mean, you're out here, you're trying to get promotion to get this fixed, get this under control?
I think that one of the things that's really tough for kids is that kids don't know how well they're seeing. Right? So even if a kid is just playing and doing all their regular things, they still might have a vision condition that we don't know about. So parents and people that are taking care of children might not notice that their child has some type of vision impairment that could be affecting their learning. So advocacy and raising awareness just for regular checkups is really important.
Okay. It's a genetic issue as well?
Yeah, so nearsightedness is in part a genetic issue. There's actually a lot of factors, and it's actually quite complicated when we factor everything in, but genetics and ethnicity are playing factors in the development of nearsightedness in children. So when you have one or two parents that are nearsighted, it really increases your risk.
Okay. What are the other risks, or are the kids that shouldn't be doing? You know, when they say, don't get too close to the TV.
Yeah.
Is it stuff like that? And
Yeah,
those
absolutely.
aren't just sort of myths?
So nearsightedness is affected by our environment in lots of different ways. The two main factors that we know about are near work, so how close you're reading and how often you're reading up close. So like cell phones, tablets, stuff like that are all included in that group, and playing outside.
Okay, but tablets keep children quiet sometimes, so
Yeah.
it's a can't-win situation. But this can be corrected when it comes to children. When they have myopia, it can be corrected.
Yeah.
Correct?
So we cannot stop myopia. which is why early detection is so important. So once we detect it, what we can do is we can implement different types of treatments that help to slow down the progression.
Okay.
Because the thing is, unfortunately, myopia when detected in children always increases.
Okay.
So once we have a kid that's nearsighted, as they grow older, because their eye starts to grow with them, their nearsightedness will always increase. So implementing a solution that helps to slow down that progression is really important.
Okay. 20 seconds. Eyes to A's?
Yeah.
Something important that you're
Yes. So Essilor is working with the Ottawa Carleton District School Board as well as the Education Foundation of Ottawa to do vision screenings all throughout Ottawa.
Yeah.
Yeah. The program's called Eyes to A's.
That's
and
great.
it's really just about reducing the barriers to access for kids to get vision checks and that kind of thing.
Good job. Essilor.ca. Thank you very much, Doctor. Good work. More daytime coming up.